Hello again and welcome back to 90 Day Dental Day 38, continuing along with the perio theme, and today we're talking about avoiding periodontal litigation with Deepak Simkhada.
Periodontal litigation, just to give you a background, we all are aware of the situation. It's been pretty bad for the last few years. If you really look into it, why it is getting worse, there could be a number of factors. National and local newspaper publishing about dentists being sued, and there are dental law firms promoting no-win, no-fee cases, other law firms chasing the patient, our regulatory bodies publishing full-page articles on making a complaint about the dentist. All of these things certainly hasn't helped. I would like to discuss a case study. She's a patient of mine, 54-year-old lady, generally fit and healthy. She had quite advanced periodontal disease, let's say stage 4 grade C, when she was presented. After a couple of rounds of treatment, non-surgical as well as she also needed some surgical treatment, and this is how she looks now. You can see her periodontal tissues are looking good. Her oral hygiene is very good. If you were to look at her perio charts, all the pockets are 4 millimeters below. There's hardly any bleeding at the moment. You can see her disease is quite stable. However, it wasn't the case all the time. She was not very happy with the care she received in her previous practice. And she had a lot of questions regarding her care. Then she decided to take the matter forward, and the legal battle was 2-3 years long. At the end, it was settled out of the court and she was paid £50,000. Here I'd like to discuss about a few different ways that we can minimize our risk. One thing we cannot do is stop our patient from making a claim against us or taking us to the court. What we can do is we can take various steps so that we can minimize those risks. Also have a robust claim should that problem were ever to arise. A lot of time our colleagues and peers, they say it's all in the notes. However, I would like to think it's a little bit more than that. Just having good notes is very, very important. However, that's not all. There are 6 steps to it, and that's what we're going to discuss here. The first one is thorough assessment. A lot of time our colleagues and we are doing BPs on our patient on a regular basis. However, there are instances where there are BPs are not consistent between practitioner to practitioner. At the same time, a lot of practitioners are not even doing the BP. And then a lot of the other time, people are basing their treatment on the BPE. BPE is just the assessment tool, a screening tool. It's not the diagnostic tool. As soon as we have the BP codes of 3s and 4s, we need to think about further assessment so that we can come to a conclusion and to the diagnosis. We are taking bite wings on a regular intervals, but then are we taking periapicals when bite wings are not sufficient? These are the things that we need to be very aware of. Now, if you got BP codes of 3s and 4s, then you need to move on to CPE, Comprehensive Periodontal Examination. What is Comprehensive Periodontal Examination? It essentially has got 5 things: periodontal pocket depth, bleeding and probing, mobility, recession, and furcation. For every single patient who have got code 3, you got to capture those data after the perio treatment should the site still has got pocket depth of 4 millimeters or more. Anyone who has got pocket depth of 5.5 millimeters or more, you have to have these data before and after perio treatment. Next one is diagnose accurately, and also follow the new classification and diagnosis, which are 2 different things, but then rolled in together in 2017. According to the new diagnosis, now you need to look at the patients, the amount of disease they have, the extent, whether it's localized or generalized. You got to have some form of staging, 1, 2, 3, 4, and grading. So the disease needs to be staged and graded. Now that will tell you the historic amount of problem they had. And then in terms of the diagnosis, it will tell you the current situation, whether disease is stable, unstable, or in remission. And you need to point out the risk factors such as smoking, diabetes. If you got other risk factors such as poor diet, stress, do mention them on your notes. Third one on the list is communication. the most important part here is, are you tailoring the advice looking at your patient? The information that you provide to them, can they digest it? Have you given them the advice just verbally, or have you provided the same information on your websites, on the leaflets that you produce? But also at the same time, the leaflets that you give, trying to have the leaflet that reflects the treatment that you have proposed, the treatment that you have discussed, rather than a generic leaflet. At this point, if anybody wants the leaflet from myself, please get in touch. We can get something for you. Also, you can use audiovisual tools. Maybe show them periodontal disease and different treatments available to them on an iPad while you're writing down your notes. And then the consent forms are equally important. Consent forms should contain all the information that you have discussed, all the treatment options you have given to them. If you have discussed external referral to the specialist, all of those things should be included on the patient communication. And never to get the consent form signed until patient has all the information they need and time to digest those information. Number 4 on the list is record keeping. It's one of the most important ones to minimize your risk. All the information that you gather from the patient, social history, medical history, their past disease experience, any treatment they had in the past, all of those things have to be recorded in detail, as well as their oral hygiene routine at the moment. What kind of brushes do they use? Do they use electric, manual? Do they use any interdental brushes? But also, what kind of treatment have you proposed? Have you also advised them to go and see the specialist? Have you discussed poor prognosis of any tooth and so on? All of those things have to be recorded in detail. Do not miss out those things, because they will play a vital role in minimizing your risk should you ever have to go down that route tomorrow. The 5th one on the list is good case management. Okay, you have told the patient they have got periodontal disease, you have recorded all the notes, you have documented everything properly. However, if you are not providing a good, thorough periodontal treatment, that patient's not going to get better, and your risk will still be quite high should you were to be challenged tomorrow. So what is good periodontal treatment? It is not scale and polish, and we got to understand that it is not 15 minutes, 20 minutes, quick whiz around any tooth. Provide a good treatment. They require either yourself or one of your team members, and if you can't provide, then please refer those cases early. The last one on the list is refer early, especially if patient has got very advanced form of periodontal disease. If patient has got disease that you don't feel comfortable managing yourself, either you can refer to one of your team members, maybe to one of the other dentists or hygienists or therapists in the practice, or to the specialist, someone down the road. Refer them to dental hospitals. Give that option early and make a note of it. It is very important that patients are given all the options available, whether it's NHS or private, and given those options early means they might be able to save that tooth and hence minimize, that reduces your risk. And finally, once you have all of these 6 points in place, you need to have all of those tidied in your practice protocol. It's very important for every practice to have a written perio protocol that explains who is responsible for what, who is responsible for the diagnosis, who is responsible for the treatment, who is responsible for the referral, what kind of x-rays you take, how many x-rays you take, and so on and so forth. So perio protocol is very, very essential for any practice, and everybody in the practice should be aware of their duties, their responsibilities. In that way, it's very unlikely to have little problems keep happening again and again. An audit was happening in your practice. Is everybody doing the BP? How often the BP is being done? When the BP is 3s and 4s, are you taking those x-rays? Are you taking bite wings? Are you taking PAs? What kind of quality of the x-rays are those? How many cases are you referring outside? Are you referring cases in a timely fashion? All of those things are important, and having a good perio protocol and doing regular audits will help you catch any problems early on. To sum up, how to reduce your risk in periodontal management. There are 6 main points: assessment, diagnosis, communication, record keeping, treatment planning, providing the good treatment and the referral, and having them tidied in a good practice protocol and having an audit now and again to make sure that these things are in place and these things are working are vital. If you'd like to find out more, or also if you have any questions, you can get in touch with me on the usual ways, perio@deepak.com, or send me an email. Thanks for listening. Have a good day.
Very succinct and a really good description of all the issues that can currently occur, and it's very, very topical, of course, at the moment. Tomorrow we'll finalise the Perio section, and in the meantime, please follow us, please comment, please support us and like us on both YouTube and Instagram, and we look forward to welcoming you back. Thank you very much.